Welcome to Body by Poly. I'm Dr. Alain Polynice, a board-certified plastic surgeon with over 25 years of experience. I started this podcast to have real conversations, not just about surgery, but about healing, recovery, and what it truly takes to feel confident in your body. Whether it's correcting a past procedure or pursuing a transformation you've been thinking about for years, I'm here to give you the honest truth. No hype, no sales pitch, just expert insight, hard-earned experience, and the conversations I wish every patient could have and hear before and after surgery. This is Body by Poly.
Okay, Dr. Polynice.
Why, Karen, hello.
I'm so excited I get to interview you today. You and I have been working together for about 3 years now.
Yes, 3 years.
Yes, you moved to...
Since I made the move from New York.
Yes, and you've been in our practice, which has been great. And we were so excited to introduce you to the community. And you are above and beyond anyone else in Santa Barbara as a surgeon.
Well, I try my best.
You do a great job. So I'm really excited I get to ask you a few questions today. One of the things that I think really stands out about you and makes you different is that you have just very naturally become rather a fixer in some of your cases. And I just want you to go into that a little bit.
Well, yes. I mean, I do a lot of revision surgery. That is a big part of my practice. And I guess you kind of get known for that. But it's always something that's fascinated me to, tackle complex cases, especially when you go back to my training. I go back, I remember I trained in plastic surgery at the Mayo Clinic. And that was a big part of my training because people would come really from all over the world, all over the country, to the Mayo Clinic with really complex problems. And I remember one time, it was early on in my training, we had this really complex problem and, not the kind of thing that you would just take on lightly. And I remember, talking to my attending saying, well, how are we really going to do this? I mean, this is such a complex issue. And he looked at me and said, if we don't do it, who will? I mean,
Right.
So that's the kind of attitude that I had during training. And listen, some things are not fixable. Some things are beyond, our capacity to repair. But yeah, I sometimes adopt the attitude of, if not me, then who? It's one of those things where if you have the ability to do something, even though it's complex and could be very risky or dangerous, the key thing is to really have that conversation with the patient to really explain what the risks are, what the benefits are, discussing all of the options. And if they're agreeable and they're willing to, go down that road and take the risk, then I'm willing to do it. So.
Do you think that training you had there sort of really made you who you are today as a surgeon?
Oh, definitely. Absolutely. Because it's one of those things where it, I guess, teaches you to be cautiously fearless. You know what your abilities are and you're willing to push the boundaries of what you can do because it's amazing what you can achieve when you have the confidence to tackle certain complex problems. So yeah, it has become a big part of my practice, pretty big, complex revision surgeries. I mean, when I first started in my practice, I used to do a lot of microsurgery, after trauma or big cancer reconstructions. One of the big things I used to do is revision hernias, like when patients had really big, complex abdominal hernias. I used to do a lot of those reconstructions as well. So reconstructive surgery has been a big part of my foundation. And that's led into the revision reconstruction part of my practice now.
That's great. I really like that about you. I know we've had a few people pop in that have had procedures in another country. What's your opinion about that? I mean, obviously they're going there because it's less expensive.
Right. Well, that's an interesting topic because I did a lot of I trained at the Mayo Clinic, like I said, but I also did a lot of training abroad. I traveled around the world visiting amazing plastic surgeons who were top of their field in different countries. And I learned a lot of techniques that I've incorporated into my practice. So the thing is that there are fantastic surgeons all around the world. But when patients typically go abroad for surgeries, like you said, they're looking for a cheaper version. They're looking for discounted plastic surgery. And that can be dangerous in and of itself. When you're looking at plastic surgery, probably a discounted plastic surgery is not the way that you would want to go. It's discounted for a reason, right?
Yeah.
But the most important thing about that is that when they go abroad for surgery is that they don't have adequate follow-up. Typically, they could be abroad for a week, maybe two, but then they're coming back home and they don't have the benefit of being able to be followed up by their surgeon who did their surgery. So that could lead to complications and poor outcomes. So it's something to be aware of for sure.
And we have in our office taken care of some of those patients that have gone elsewhere.
I have, yeah.
Yeah.
Typically, what you'll see is patients who've gone abroad. They had surgery a week ago, and then they traveled too soon. They have cases of pretty bad infections or bleeding, or things that could have been managed relatively easily had they stayed put and not traveled so soon. But these simple things can turn into big complications, once you add the element of travel and then you having to be seen by a surgeon who didn't do your surgery, who was not familiar with what was done or how it was done. So all of those things can add up and turn into pretty bad complications.
Yeah, it's really sad when you see those patients coming through because it's almost like they regret their decision to do it after the fact.
To a certain degree, they do, and I've taken care of a lot of these patients, and they sometimes are very thankful that I'm willing to take care of them because they say, "Oh, I'm so happy that you're willing to take this on because, other surgeons maybe weren't willing to." And it's difficult to really step in and deal with a complication that's not your complication.
Yes, and most people don't do it. Most offices don't do it.
Yeah, that's true.
But we do it. So I like that about our office.
I have had to, yeah.
What would you say your core philosophy is?
My core philosophy is really listening to the patient to try to understand what their ultimate goals are and to help guide them toward that goal in a safe way and obtaining amazing natural results.
And okay, so do you have a favorite case that you love when they walk through the door? You're like, oh, this is my thing. I've got you.
Well, I do a pretty good breast lift. So, because a breast lift is reshaping and sculpting somebody's own tissue. So whenever I can do something using a patient's own tissue, whether it's a lift or a fat transfer or body sculpting, that's what I really like because I feel I can really achieve an amazing natural result using their own tissue, and that's a long-lasting result as well.
Yeah, and those patients are really happy.
Yeah, and those cases get me excited.
Yeah. What is a typical day? Well, we know what your OR day looks like, but we can go into a bit of that. But I want to know, you've got a day off. What are you doing normally? What does Dr. Polynice do on his day
On
off?
a day off?
Yes.
Wow. All right. Well, I'll wake up early and feed my cat. That's a big thing because
super important.
He's a very strict on the schedule. 5:30, 5:40 has to be fed. But a typical day, if I have a day off, really day off, then I would love to go flying.
Okay.
It's something that I've always had a passion for, but only something that I was able to do later on in life. Because obviously, school and work and all of those things and life and kids, it's not something that it's easy to incorporate into your life. I mean, so it was later on that I became a pilot, but it's something that brings me a great sense of satisfaction and peace when I'm able to go flying. And I think, flying and surgery have a lot in common.
Yeah, I was going to say that sort of feeling you get when you're flying, that sense of calm and purpose, meticulousness, that sort of transcends into the OR. When you're in the OR, I've seen you on surgery days. I go in there and hassle you a little bit trying to get content. But you're just so calm. You'll have a huge or sometimes two huge cases in front of you.
Yeah.
So how do you think those two things, flying and surgery, are connected?
Well, I feel that both flying and surgery require meticulous attention to detail before
Mm.
you delve into any of those activities because they're inherently very dangerous.
Yeah.
So you have to have meticulous preparation, just like for a flight. Before you get on that plane and start up the engine, you have to do your pre-flight check. You have to do your walk around the plane. You have to make sure that all the systems are working as they should. You have a pre-flight checklist that you go through item by item. Even though you've done this 100 times, you still go through each line item, making sure everything's fine. You have to make sure the fuel content's fine. You have to do your weight and balance check on the plane to make sure that everything's good to go. You have to check the weather at your origin and your destination. So if any one of those things isn't aligned or proper, you cancel the flight. So the same thing with surgery. Before
Yeah.
going into a case, I have to do my preoperative checklist. I have to make sure the labs are okay. I have to make sure the patient is fine medically. She has a medical clearance. I have to make sure that the lab work is fine. I have to make sure that the OR and the team, everything's good to go. If anesthesia is okay, any one of those elements is not in place, cancel the case. So by doing all those meticulous checklists, that's how you get the patient from A to B safely. And that's how I get from my destination on the plane from A to B safely as well.
We're doing this interview today because we're launching your new podcast, which I'm really
Right.
excited about because some of the things about you people don't realize till they meet you. Like you are funny, you are smart, you are a great conversationalist. And yes, you're going to be their surgeon most likely once they meet you. So, with this podcast, I wanted it to be a way where people could really get to know you and understand who you are as a surgeon and a person. So, for you and people tuning in and either watching your podcast on YouTube or listening on Spotify or Apple, what is for you why you want to do this podcast?
Well, I've been doing this for a very long time. I've been in practice for, 25 years now. And I do feel that, I have a lot of information to offer, and I want patients to have a good place where they can go for those resources to have their questions answered. Because it's all about getting the right information to make the right decision for yourself. Because there's a lot of information out there. With the internet, people can just Google anything, but there's a lot of misinformation as well. So it's important for patients to get correct information from somebody who has some experience, who can hopefully guide them in the right direction. And yeah, I just want also patients to get to know me because that's one of the great joys of practice is getting to develop relationships with patients, making them feel comfortable and guiding them towards their desired outcome. Because there's no greater reward than having somebody, come to your office after surgery and just look at themselves for the first time and just really literally cry tears of joy because of the amazing transformation that they're seeing. Despite the bruising and the swelling, they can see beyond that and see the results. So that's just so rewarding for me.
Yeah, I've noticed that because I'm in the office sometimes on your post-op days,
Yeah.
and patients are so happy and everyone is hugging one another.
Yeah,
And that's what you
I
you
get
know
naked
what I
hugs all
mean?
the
I
time.
mean, smiles and hugging, and it's like they're your best friends by the time they're done with the case. And that is another thing that's really unique about you. So I'm excited for this podcast. I'm excited for you and for people to get to know you. So
I am as well. Exciting times.
great. Thank you.
Thank you. Thanks for tuning in to Body by Polly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.